how do you turn something like that into a quality improvement project? Well, I spoke to the consultant I was under and the pharmacist, told them that, you know, most of your patients are deficient. Not very many of them have DEXA scans, and not very many of them are actively looked for. So I suggested that this should be prevented. And the pharmacist agreed that, indeed, patients with lysosomal storage disorders in general have been found to be deficient in her experience. So she proposed to write a vitamin D policy for the department. And so I contributed to that with my knowledge of vitamin D and the evidence from my own study. And as my time was coming to an end, I left it in her hands to complete. Okay, so this is what we did. So she wrote up this policy, and the downside is she didn't follow up. I tried to contact her on a number of occasions following this, and she said something about, in her words, hitting a brick wall, and then subsequently didn't reply to my emails. So this may seem like a failure, but important lessons can be learned from this. Okay. So the most important thing I'd say is that if you want to turn your modules or your projects that you might be involved into quality improvement, think early, think from the start about how this may happen, and speak to the right people, because in most departments there will be some people that are quite enthusiastic about implementing changes. So make sure you speak to as many people as you can. And then actively follow up. Basically nag them till the cows come home, because if they see you everywhere, there's only so many times they can ignore you. And furthermore, even if no lasting changes are implemented, you can still use this as an experience to learn and try and find opportunities in future and work on them. For example, since then I have been involved in other opportunities, including improving patient handover. Literally this week I just finished one on hepatitis A management from a health protection point of view. And I've implemented that lesson of follow-up, so hopefully I will be told about the changes that I've recommended. So now the work is to you.